All right, with that, we're going to go ahead and get started. Thank you for joining another Mathematic webinar. My name is Nicole Owens. I am the Director of Marketing Communications for the organization. If you're not familiar with Mathematic, we are a membership-based trade association that works to bolster the medtech industry, primarily in New England, through education and connection, advocacy, and awareness. Today, we are talking about heuristic analysis with our friends at Galero. Before I turn it over to our presenters for today, I do have a couple housekeeping notes. So first of all, anyone who registered for the webinar will receive a recording after the webinar. We also have time for Q&A. So anytime questions arise to you during this conversation, please feel free to put them in the Q&A function at the bottom of your screen, and we'll do our best to answer all those questions in the time allotted. All right. Without further ado, I am pleased to turn it over to Lauren and Grant from Galero to present to you today on heuristic analysis. Take it away.
Thanks, Nicole, and welcome everyone. I want to thank everyone for taking time out of their busy Tuesday to join our presentation today. Like Nicole mentioned, we're going to be talking about heuristic analyses and how they can be an alternative option to more classic usability testing. So we'll be your hosts today. My name is Grant Leffingwell. I'm the Director of Human Factors and Design here at Galero. I've been in human factors for over 2 decades, most of that time dedicated to medical devices of every type. Lauren Harrison's with me today. She's a human factors engineer at Galero, has a lot of expertise and experience with a wide range of med devices, and she is our resident heuristic analysis guru. So the bulk of the presentation is going to be from Lauren, but I'm going to get us started off with some background and some context and some basics about heuristics. But first, I just want to start off with just a little background about our company, Galero, and the overall Santa Group. We are a global CDMO that works across the entire healthcare space, end-to-end engineering for pharma, med devices, diagnostics, you name it. We have a robust manufacturing offering, a lot of injection molding, everything from rapid prototyping, small clinical builds to large-scale, high-volume production. Galero is Santa Group's U.S. division based in Durham, North Carolina, with facilities across the U.S. and northern Mexico. Santa Group overall, there's about 850 of us working in research, development, engineering, and that includes human factors, human-centric design, which is what Lauren and I represent. So kind of a high-level outline of what we're going to be covering today. First, we'll start off by explaining what is a heuristic eval. I saw the registration list. I know there's a lot of HFEs on the call, but some of the audience might not know or might have limited experience with these. So we'll start off with some of the basics there. We'll talk about the benefits of heuristics and some considerations for performing them. We'll talk about when they should be done during the product development process, because that's critical. And of course, most importantly, which is the reason we're here today, is we'll describe how to do them and sort of some tips and tricks that we've learned along the way to help them be effective and impactful to your product. And at the end, we'll leave some time for some Q&A. So feel free to enter as we go along any questions you might have in the Q&A question box there. And at the end, if we have time, then we'll get to as many of them as we can. So what is a heuristic analysis? This is the common definition that most of us are aware of. These come straight out of the HF textbooks like Wickens. FDA's guidances state this almost identically, sort of the standards 62366 and so on. So I'll just read the definition aloud here. It's a process that objectively evaluates the design of an evolving user interface against established design principles based on known best practices, standards, and industry guidances. So just want to parse out a handful of these words. First of all, it's a process, right? So it's not like a discrete event, something that has some rigor to it. It's an objective evaluation. We'll get more into this as we go on, but it's a very sort of objective process, agnostic to anything else that might influence your conclusions. And anytime you hear the phrases evaluating design of an evolving user interface, you're obviously talking about a formative. And that's what a heuristic analysis is. It's a formative. So sometimes you'll hear us referring to it today as a formative evaluation, as a heuristic evaluation, but for all intents and purposes, we mean the same thing. You're conducting an analysis as a way of evaluating your ongoing design. Just so that we're using the same vocabulary, Lauren is going to go more into this later. But when we talk about standards, we're talking about those, HFE, ergonomic, anthropometric standards that are published and widely used around the world, whether or not for med devices, if it's HE75, ISO standards like 9241, mil specs, the FAA regs, anywhere where a large volume of performance data has been captured. Industry guidances would be some of the things that we're also very familiar with. If you've read Nielsen's usability heuristics or Zhang's or Schneiderman's, these are also very commonly available. And as I mentioned, Lauren will go more into detail later, but just wanted to introduce those terms as we move forward. A few words about what a heuristic is not. As we mentioned earlier, it's objective, it's not subjective. Heuristics themselves exist for a reason. They're based on science, they're based on data, they're based on data sets across a large mean of the population, observations that are empirically derived. So they're very robust. It's not a way to avoid usability testing entirely. We titled the presentation an alternative to usability testing. And it's an alternative in some circumstances. A heuristic will tell you how well your user interface meets established design principles, but it's not going to tell you how your device is going to be used in the real world. That can only occur with usability testing. It's also not an expert review. A lot of times people use those interchangeably, and it's not appropriate to do so. An expert review is something different. It's far less formal. It's less rigorous in the process we're describing here. An expert review is just one small part of a heuristic evaluation that we'll go into in more detail here shortly. Some of the benefits of a heuristic, as we mentioned, it's another a tool in your formative arsenal. It's another option for you to use. It provides high value defensible information. Again, that defensible aspect, I think most of the HFEs who are watching this, we've all had those circumstances where stakeholders maybe didn't like our conclusions or didn't like what they saw in the test room and pushed back. But the nice thing about a heuristic evaluation is because it's agnostic, it's hard for anyone to argue with empirical data, standards, and guidances. So it's very supportive of our goals in that area. And it's lower cost and shorter timeline than many other types of formatives. And we'll go into that here as well. So as mentioned, it's one of the tools in the formative toolbox. The chart here is one that I've adapted from, I think it's in TIR 59, that shows human factors and usability engineering in the context of risk management. But I like using this because it gives us a great bird's eye view of all HFE UE activities across the product development process. Everything from researching, planning, designing, managing risk, evaluating, all the things that we do. Down towards the bottom are the light blue are the evaluation activities. And everything up through the verification phase can be considered some kind of a formative. And there's a lot of different kinds of formatives. They include, from the early phases, you might choose things like contextual inquiry or shadowing, user and use environment research. You might be evaluating concepts and trying to down select which concept might be better. Different kinds of exploratory studies, cognitive walkthroughs, and so on. And once you get into the rigors of the design and the development phases, that's when formatives usually take a more familiar approach that we're used to seeing, the usability testing being the most common, both simulated use and directed use. But there's others, there's comparative studies, there's cognitive and workload assessments, label comp, and of course, heuristic, which is what we're here today to chat about. So you choose which type based on what your objectives and your goals are. The catch with heuristic evals, though, is that you can't do them too early before you have an interface, right? And you can't do them too late when it's too late to change the design. So you need to do them in this window here, basically from inputs through verification. That's when they are the most impactful. That's when your results can have the most bang for the buck. And speaking of bucks, let's talk about the benefits a little bit more. Here we've got another bird's eye view of a typical formative usability project. It's just sort of an abstract timeline of sorts. Usually you get started right away designing your study, developing the methodology, writing protocols, study documentation, informed consent documents, moderator guides, and so on. Somewhere along the way, you start recruiting the participants that you're going to be using in the study. And then you'll execute and report on the findings. With the heuristic approach, you'll see it's much more streamlined. How long it actually takes is just related to the complexity of an interface, but it's always considerably more streamlined than a formative usability study. And with those timeline benefits comes, cost savings that can be significant, especially when you're adding in not just the time and labor, but the expenses of recruiting and paying participants and facility fees and so on. So these are some of the other benefits to it. So we talked about what they aren't, but let's talk about when you shouldn't. A few more words, because if it's cheaper and it's faster, why don't we do it all the time, right? We get that question a lot. When should we not do heuristics? So like we said a few slides ago, you don't want to do them until you have an interface that's actually progressed enough to be analyzed. You can do it on an early concept, but you're probably not going to be able to draw many meaningful conclusions. And the conclusions you do draw are probably only going to be valid for a short period of time because the devices are changing so rapidly in those early phases of the product development process, and they change substantially as time goes on. But you also don't want to do it near or as a part of validation activities. You could, but you've missed your window to impact design. And if you discover something, it's going to be quite difficult programmatically to go back to the drawing board by that point. And the results are not going to be acceptable as validation data anyway, because the regulatory bodies require that to come from simulated use testing. So again, you want to do it right in those inputs, outputs, and verification phases. And not during anything else. You also don't want to do it as a way we mentioned earlier of getting out of usability testing entirely. Heuristic analysis might tell you where in the interface that users might struggle, but it's not going to tell you why, right? And that's the power and the importance of user testing, is being able to observe something and then have a conversation with the user afterwards, dig down into the root cause of why did this occur. And you don't get that from a heuristic. It's not going to tell you why they struggled. It's not going to tell you what the differences in your user groups are. So if users of one type struggle in this area and users of another type struggle in another, a heuristic isn't going to inform those kinds of nuanced details. So one of the things you might think about, we typically approach the formative evaluation as the standard two formatives and a summative approach. Maybe you start off with some, like I mentioned, user and use environment research, and then you have your two formatives and a summative. One of the things you might consider is replacing one of your formatives with a heuristic. And if it makes you nervous about maybe we're not getting as many users through our process, a way to address that is just to expand your summative a bit. Maybe include a robust pilot for your summative that occurs, say, a few weeks or a month upstream. So you have an opportunity to get more user data before you actually enter that validation phase as an official for all the marbles type of data collection activity. All right. So thank you for enduring those backgrounds and basics, but that gives us little of that. So we're going to turn it over to Lauren now, who's going to be giving us some tips on how to perform one.
Awesome. Thanks, Grant. So now that we understand heuristics a little bit better and where they can fit into our design plan, I'll walk us through the process of conducting one. So if you want to flip to the next slide, please. There we go. So there are 4 milestones I want to touch on. It's worksheet development, training, actual analysis and execution, and your final reporting. I will dig into each of these topics a bit more in the coming slides, but just as an overall thing, if you guys have any questions, feel free to throw it in the Q&A at the bottom during these talks, and Grant and I will try to field them at the end. All right, I'll flip to the next one. There we go. All right, the worksheet should really consist of 4 major tabs. The core information that you really need to develop is the heuristic checklist, your scorecard, your standards that you want to comply with, and your user needs compliance if you're at a design state that allows that. The most important component of this worksheet is your heuristic checklist. This portion walks through the device's workflow and essentially evaluates it for compliance against design principles. In the process, these principles are known as heuristics. I kind of like to think of them more as rules of thumb. You can have any number of heuristics given for a given analysis. I would just caution you to ensure that you have all relevant heuristics for your product. A lot of papers are more targeted for GUI design or web focus. So just be cautious when you're going through your research stage and you're picking out your heuristics, that you're picking ones that are particular for your device or for your system. For each of these heuristics, it's best practice to have a few questions to help guide your analysis. One of the heuristics that comes to mind is visibility of system status. So I could probably guess and tell you guys how we could apply that to design. But to complete the best analysis you can, I really recommend deciphering out your definitions into questions for your analyst and yourself. This might also help keep your evaluators on the same page and in the same lane when they're going through their evaluation. So following that, it's key to gain some more quantifiable usability standards and include them in your standards tab. Here we can look at HE75 or that military standard and understand if our system passes or fails something as simple as button size or lever length. If your design state does allow it, you can also insert some user needs here and go through pass fail with them as well. Flip to the next one. Perfect. So as I mentioned before, when determining your heuristics for your analysis, you should take care to select the ones that are most important for your application. There are 10 specifically identified for interaction design by Jacob Nielsen, and additionally, they're the 8 golden rules of Schneiderman. In terms of medical devices, Zhang and team took interest in both Nielsen and Schneiderman when creating their list for applied heuristics. This is all to say that there's a lot of resources out there, a lot of standards that you can reference to create your own list to move forward with your analysis. There's anywhere from 8 to like 20. It's really up to you as a team to determine which ones apply to your device design and select them for your heuristic analysis. All right. So this is just a quick example of a heuristic question set. Obviously, we have the name of our heuristic there on the left, and then the definition on the middle, whether that's from a research standard or you came up with your definition yourself. To determine those questions for analysis, I typically like to pick out the themes within my definition. So, for example, here in blue, you have highlighted the informed feedback and display of information and time. So using those 4 themes, I was able to come up with a few questions for analysis. So what is the current state of the system? Is it clear? What can be done at this current state? Where can users go? And so on. And this is not to replace the thinking of an HFE. I don't want people to go through and make a heuristic, a yes or no process. This is just to kind of guide your analysts, make sure you're all on the same page, and make sure that you're ticking your boxes as you're going through each heuristic so that you can make sure that your review is holistic. Oh, perfect. So once we've identified our heuristics that apply to our device, We'll then need to align our tasks. So in a perfect world, your task analysis would be complete and signed off at this point, but it's okay if it's only in its draft state because you'll likely learn more about your projected workflow through these exercises as well. So for each task and step for your system, you should evaluate it against each individual heuristic. So for example, if my step is opening packaging, I would analyze it through all of my listed 10 heuristics and then move on to my next task. And we'll get into that a little bit more. Ultimately, this can make for a really, really long review period if your system is complex. So keep this in mind if you're determining your scope of work. But based on your design state, you may be able to include or exclude tasks, and that's totally fine. Your system doesn't have to be fully functional to be able to get through a heuristic analysis. Just be sure that when you're documenting in your report that you denote which tasks you did test and which ones you've excluded. So I recommend that you start with a blind system, meaning that your analysts don't have access to an IFU. If you do want to evaluate the IFU as well, you can do this as a separate analysis specifically for the IFU. Keeping both the device and the IFU separate is your most ideal option because it allows researchers to optimize their heuristic list for the user interface. So for example, if I'm working with an auto injector that also has an IFU, my heuristics that I'm pulling for my auto injector might be ergonomics based on use. Whereas for the IFU, I might be looking more into text coloring, text size, things like that. So making sure that your heuristics align with your UI is really the key here. All right. So now we have our heuristics and we have our tasks aligned. What do we do now? It's determining that scoring. So whether you're working in-house or as a consultant, both internal and external teams should be consulted for determining your scoring. The way you score your violations will ultimately affect your reporting and analysis of the data. So I found it helpful to determine scoring inspired by risk. Now, this does not mean to correlate with the rest of your risk documentation. In fact, let's keep those completely separate so that it helps to make you look at this in an agnostic way. But on the right here, we have an example of overarching scores we might use. So how you get to those scores should further be defined by you and your team. For example, the minor usability problem and the major usability problem should then further be defined. What does that mean to you? What does that mean in the context of your device? So within your scorecard, you should leave space to denote the UI element in which the violation occurs. You should also have space for a description of the problem, the potential harm, and the heuristic that was violated. In ours, we also actually have a column for a recommendation for improvement. We have some HFEs on the team that have a background in design engineering as well. So we can often provide recommendations there. And then also that score to help us categorize the violations at the end. Okay, so now we've developed our worksheet for analysis. We've determined what our scoring is going to look like. Now it's making sure that your whole team is aligned and on the same page to move forward with the evaluation. So each analyst should run through the worksheet functionalities and the timeline with the PI prior to execution, just to understand the product nuances and the state that it's in, also the nuances of the worksheet. Depending on how you create your worksheet, it might be more complex. So just making sure everyone's on the same page there. This is a crucial step in the process to ensure iterator reliability between your analysts. This is only one of the ways that we do it, and we'll talk about a second way that we do closer to the end of this presentation. So broadly, I want to talk a little bit about timing, how we set things up. So depending on the complexity of your device, we usually shoot for blocking off a whole day per evaluator. Typically, we have about 3 evaluators. We actually have some data from 6366 that states 3 is a baseline. Also, Wickens in his HFE textbook mentions that one person will probably miss most of your usability problems. So having those backup HFEs will help catch more problems. He actually recommends between 3 and 5. So We usually set it up with one day, HFE1 goes through their analysis, whether it's a comparative heuristic where they're doing 2 systems or just one. And then at some point following that evaluation, whether it's day 4 or day 6, you'll meet again and do a team review of the heuristic data that you've collected, which I'll get into in the next slide. So just to go over broadly the meat of this evaluation, I like to start with a big brain dump of any initial notes of the device before getting started. So if I notice anything usability-wise that is a red flag to me just by looking at the product, I'll write down those notes just to kick off, and then I'll review those notes towards the end to make sure they've been captured somewhere in my heuristic analysis. So I've added a little graphic here on the right that kind of shows what the format might look like for you. So it's essentially, you're going to read your task 1. So let's say that's opening your package. And then you're going to read each heuristic and apply it only to that task 1. So for example, for opening packaging here, I would apply it to heuristic 1, consistency and standards, visibility of system state, match between system and world, so on and so forth, all the way down that list, and look for violations. If there has been a violation, I would denote it on this checklist here. And then I would also write down that violation and description and potential harms and score on my scorecard. So we're capturing it in 2 locations. So we're going to go through task 1 through, let's say there's 11 tasks, all 11 tasks for each individual heuristic. So this is where things can get to be a little bit time consuming. We've had things take like 8 hours before. So this is where you've really got to dig down and focus and make sure that you're getting through all of your heuristics and all of your tasks for your product. So we then would move into our standards review. That's that more quantitative analysis of your standards. We'll go through all of our standards based on pass, fail, and then we would do the same thing for our user needs. So we'll go through each of those, do pass, fail, and then you as the evaluator, your singular evaluation is complete. Following that, your HFE2, your HFE3 will do their evaluation alone. And then you would meet as reviewers in your review meeting. This is our secondary check to make sure that we're kind of all aligned in our evaluation, doing things right. We would discuss any conflicting violations. This is where you can be an advocate for why you chose something, or you can defend something against somebody else. Here we also do a complete review of the sheet and make sure nothing's missing. And we also talk through a little bit of high-level conclusions. This meeting can be pretty long. I'm 2 hours to 4 hours to get through all of your data. So I really recommend as the PI to go through your data beforehand and kind of highlight where you see those conflicting violations. So you kind of have an agenda for talking points when you get into that meeting. Right. So now we have developed everything. We've done the analysis. Now it's time to report. So we can either report our findings through PowerPoint, or if you plan to, or that's only if you plan to show a ton of images. But if you would rather, you could also do it through traditional document style reporting. It's totally up to you and how your team usually handles reporting. I found it beneficial to split my results by task and present each scorecard entry by task. In that way, I can then highlight my key takeaways or my major violations. Those high scoring major violations we call red flags. And these red flags require further analysis and discussion into potential harm, potential HF roadblocks, and any further improvement. So that's where we kind of get into the nitty-gritty of the analysis part. Following that presentation on heuristic violations, you can then detail out your pass-fail ratios on both your standards and your user needs. So separately for the standards aspect, you really want to make sure that you're analyzing this based on its risk to failure. So for example, if your button is 0.5 millimeter smaller than what the standard says it should be, what is the actual risk to your user? And that's so this is where you get the opportunity to step back and be a little bit more objective about what we're doing. Also for your user needs, you can kind of understand, have we hit all of our marks for passing there? How do we need to move forward to make sure that we are passing all of our user needs? So it's kind of a check-in that you can do as an HFE and then report to your engineers. So finally, it's important to bring your results together with common themes. So highlight your features that are the most risky from your HF perspective. Also, this is your time to compare between design states if you're doing a comparative heuristic analysis. And I'll show that a little bit in the next slide. But this is where you can kind of tie things together, get into the nitty-gritty of the risk. For example, if it's a medication error or a burn risk, you can kind of detail out what the different levels of that harm might look like. Are we actually reaching the threshold where these harms can occur? And just do a little bit more engineering research into it. So while it's important that all of this information is given to your clients or your fellow engineers, it's also important from the HF side to iterate your risk documents or your task analysis based on these findings. All right, so here's just a quick example of a conclusionary slide for one of a comparative results heuristic that we did. So we have here broadly system 1 and system 2. And we denote here that there are a few heuristics that were not found to be a violation to the system. So that's a very good thing to say, hey, system 1 passed all of these. Here's your good news. There's no violations here. So starting off with something good. And then moving into your standard application, your pass-fail rate. And then following that, getting into your heuristics. So of your heuristics that you're tested, of over how many tasks, how many violations were identified, and how many of those violations were scoring into your higher threshold, into your flagged threshold. And for your comparative aspect of this, have we moved forward in terms of usability? So this is a good test of have our standards passing, has that increased? Have our violations that are scoring above a 3, has that gone down? So this is a good way to kind of broadly show your clients, hey, we're moving forward on the right foot for usability. And there we go. So I know I threw a lot at you guys. If there's any questions, now would be a great time to throw them in the chat and we can answer them live. Other than that, I am all good, Grant.
Thanks, Lauren. Yeah, if anybody has any questions, feel free to throw them into the question box there. We did have someone who asked a question about what the ideal number should be in your experience of separate reviewers.
Sure, yeah. So I touched on this a little bit in the past slide, but 62366 mentions 3 as your baseline. And then Wickens actually quotes Nielsen, who states 3 to 5. That's kind of your goal for your heuristic, to make sure you're covering all of your bases, you're not leaving any data on the table. But we also recognize that that's like the perfect world. There's always times where you're a one-man team and you've got to get something done, especially in the world of consultancy. So don't think you can't do it by yourself. You can. It's just not ideal practice. You definitely want to have a backup if possible.
Great. Yeah, there's never anything wrong with too much data, except if you got the budget for it, especially. So that would be great. Let's see. Someone else asked, how should heuristic evaluations be incorporated into a quality management system? That's a great question. It should be that you treat it the same way that you would any other formative evaluation. So it's a formative. So if your QMS has procedures for controlling how your formatives progress, you just want to make sure that those procedures account for the possibility of a heuristic evaluation being conducted. So it's formative just like anything else.
All right,
Okay.
looks like we just had one come in from the chat, Grant. I'll read it. I was curious with the trend of platform drug delivery devices, could you see a heuristic analysis supplementing a threshold or a comparative analysis?
Yes, I would absolutely think that, especially in a platform context, that can provide that agnostic, platform-based data that you can then build upon, or it can supplement usability testing of the actual, with the actual intended users and the actual use environments, or even the IFU for that specific application of the platform. So I do think that as far as the comparative analysis, and the threshold approach, when you get down to that far side where they talk about talking about the differences and assessing sort of the residual use related risk of those differences, that's when the heuristics can really add some weight to any of the conclusions that you're drawing.
Awesome. We have another one here. So do participants need to have knowledge of the device/system in general, if it's an existing technology, to be considered acceptable for inclusion? So I answer that one. Your evaluators are actually going to be HFEs, so they don't need to be a physician, a nurse. You're not recruiting anyone in particular for a heuristic analysis. That's where we kind of tie into that expert review lane. So an HFE person would be the one going through this, and they do not need to have exact knowledge of the system. I always like to say in that training session, give a broad overview of your system so they know how to function. But honestly, the less they know, you might find more usability or intuitive based problems in your heuristic analysis. All right. Another one, Grant, for you. Do any of these results get included in an FDA application, 510K, particularly if class 1, or are they only a preliminary process in front of HFT?
So they should absolutely be part of your submission package. When considering whether or not to offer the clearance or the approval, FDA is going to pay most attention to your validation data. But you are going to have to provide your UE file as part of your DHF, and in the HFE UE summary report that summarizes all of your usability engineering activities that occurred. You're going to summarize all of your evaluations. As a matter of fact, I believe that one of the headings in the template that the FDA gives is specifically references your earlier evaluations, because they want you to tell the story of how you conducted an evaluation, made the product better, and so on. So is the FDA going to scrutinize the results with a fine-tooth comb? Probably not. They're going to want to know that it was conducted with some rigor. But it's absolutely something that if you do, you want to take credit for it and make sure that you reference having done it when it comes time for submission. And also at the very beginning, towards the beginning of those phases, you're putting together usually a user interface evaluation plan. And so you want to list, if you're going to do it, you want to list that the heuristic eval is one of the formative evaluations that you plan to run along with the testing. That's a good question.
Yeah. Awesome. All right. Next question. Is a heuristic analysis a method of formative analysis with the use of standards? I'm trying to understand what actually heuristic analysis means.
Yeah, go ahead, Lauren. I didn't mean to talk over you.
No, you're fine. Yeah, so Grant kind of mentioned it falls into your formative bucket because you, like he said, you are evaluating your UI through the design process. So we are using standards in some capacity. We're using a lot of design principles in the method that I described. We also will use quantitative standards in that standard review. So we kind of double dip in the use of standards. We pull design principles and we also pull quantitative standards to review. So it's kind of an all-encompassing holistic review of your system. Hopefully that makes a little bit more sense. If I forgot anything, Grant, please add on there.
Nope, you got it. I agree.
All right. And then this last question, do you need IRB approval for heuristic analyses?
We had a question as well for IRB approval. So for heuristic analyses, no, because you're not involving participants in your heuristic analyses. This is just a tabletop exercise done by engineers. Obviously, for other studies, formative evaluations that involve participants, the international ethical guidelines are pretty clear. National Research Act is pretty clear. If you're capturing data that's going to be generalizable, it's usually a good idea to involve the IRB, or at least to allow an IRB to turn you down and have that record. For summative studies, you should note that the FDA has actually specifically said they reserve the right to not even consider an application if any part of that application has data that was gathered without informed consent. So it's something to keep in mind. There is this general expectation that at least your validation study and in most cases, your formative usability studies will have IRB approval, but not for heuristics.
Awesome.
All right. Well, it looks like questions dried up, but Lauren and I will package this presentation up and we'll distribute it to the attendees later. We really appreciate everybody's time today. Thanks for joining us. I will turn the webinar back over to Nicole.
All right. Thanks so much, guys, for your time. Really appreciate your expertise for sharing this content with us today. Thank you, everyone who joined us live for this webinar. And like Grant said, we will be sending out an email after this webinar, so look forward to that. We encourage you to go to massmedic.com and check out all the other upcoming events we have. And we look forward to seeing you next time. And just a quick one more thank you to our friends at Galero, a Santa Group company, for sponsoring today's content. Thanks so much. See you next time.
Thanks.
Thank you.